Hi, you've probably seen these faces on your timeline, right? Healthcare workers in their white coats chanting "Solidarity Forever," marching on the streets of Nairobi. And you're probably wondering, wait, are doctors on strike again? Well, here's the thing. These are not your regular hospital doctors. These are part of the 8,571 universal health coverage staff who became our lifeline during COVID-19. Do you remember 2020 and how dark it was? When everything shut down and we were all scared. What a time. The government brought in these heroes on contract to help save lives. They called them the frontline warriors. But 5 years later, wako wapi? Imagine one day being called a hero and the next day being treated as though you don't matter. That's exactly what's happening here. And what exactly do they want? You see, the UHC staff want to be employed under permanent and pensionable terms like their counterparts. They want job security like everyone else in government. To top it off, they want their 5-year gratuity that they were promised by the government, and fair salaries and basic allowances and benefits. Further, they don't want to be tossed around between the national and the county governments like a hot potato. You know, those are their two employers, right? The funny thing, the counties are also saying, see,
we will not be accepting a payroll that is not properly construed, because the UHC staff since 2020 have been on a job group that is very discriminative compared to their colleagues. They almost earn, I think, a third of the salary that the rest of the colleagues earn.
So here we are, stuck between the national government saying we don't have money and the counties saying we won't take the national government's mess. Meanwhile, these healthcare workers are caught in the middle of this tussle. Families to feed, bills to pay. Can you imagine that?
We can't pay our bills. We are so tired. We feel embarrassed with our government.
We need our money to be paid, especially for the gratuity right now. If they don't want to convert our terms to PNP, they should also pay our gratuity and let us even go home.
They got so desperate that their staff started flooding leaders with messages. You know how that goes on WhatsApp groups, right? This happened until the budget committee chair had to publicly say, "To all UHC staff, we have listened to you. Please now stop with the messages." The budget committee is making serious consultations with relevant stakeholders towards addressing your concerns, which include conversation of your employment into permanent and pensionable terms, said Samuel Atandi, who is the chair of the National Assembly Budget. You see, these aren't just numbers on a government payroll. We're talking about nurses. You need them. They check on your vitals. Clinical officers who treat your wounds in hospital, and lab technicians who run your tests. Pharmacists who dispense your medication. Plus the ambulance drivers you need who rush you to hospital, and the managers who keep everything running. What do you think? Drop your thoughts in the comments below.